Hi, my name is Steven. I am 49 years old and I live just outside of Houston, Texas in a rural area called Dayton. I like doing a lot of things outside. I like to fish, work in the garden, and I do welding projects and building things. I officially started BESREMi in February of 22. Hydroxyurea is a chemo and it made me feel worse and it wasn't controlling my blood counts. BESREMi offered me a fresh start. I stay on BESREMi because it works. My numbers stay in range and I haven't needed a phlebotomy in over 2 years. And I've only needed one in just over 3 years since starting BESREMi. For me to reach CHR, it felt like I was in control. It is important for people who are new to BESREMi to remember that it can take a few months before you start seeing comprehensive results. But this is normal and it's important to keep with it because BESREMi works for the long term. BESREMi is an immunotherapy, so your immune system is activated after the injection. It's working in the bone marrow and it's similar to the natural interferon that your body produces to fight the flu. My doctor told me I might experience some side effects while taking BESREMi, like flu-like symptoms from the injection. She told me to be open with her and to communicate any and all side effects as I started taking BESREMi. And she made it clear, experiencing side effects doesn't mean that we stop treatment, it just means that we manage it. That openness had helped me trust her in the process. When I first started taking BESREMi, I had mild flu-like symptoms after the injection. For me, the side effects usually kick in about 2 days after the shot, and it feels like I'm starting to get a sinus infection, flushed face, fatigue, that general off feeling, but it's manageable. Movement helps, and it clears the fog. I usually take BESREMi on Tuesday nights, and within a day or two I feel fine and can enjoy the weekend, and it's only twice a month. If I'm feeling particularly off after injection, I may consider taking something. The injections themselves is usually no big deal for me. I've had blood draws that have hurt more. It gets easier over time, and don't let your fear keep you from a treatment that has long-term benefits. You are taking BESREMi just once every 2 weeks, so you're only thinking about your PV twice a month. I want to see my kids grow up and maybe have grandkids. It's about the long game, and BESREMi is working for the long term.
Read this important safety information carefully. It explains the serious risks of BESREMi and how to take it safely. Talk to your healthcare provider if you have any questions. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects, including conditions that may cause death or may worsen certain serious diseases you may already have. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi permanently. These symptoms may go away in some people after they stop taking BESREMi. Mental health problems, including suicide. BESREMi may cause mood or behavior problems that can get worse during treatment or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, hopeless, or bad about yourself, unusually grand ideas, acting aggressive or impulsively, thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, call your healthcare provider immediately. New or worsening autoimmune problems. BESREMi may cause your immune system to attack healthy cells, leading to conditions such as thyroid disease, increased blood sugar, hyperglycemia, or type 1 diabetes. Call your healthcare provider if you experience extreme tiredness, frequent urination, excessive thirst. Heart problems. BESREMi may cause heart problems, including cardiomyopathy, heart muscle disease, heart attack, irregular heartbeat, atrial fibrillation, decreased blood flow to the heart. You should not take BESREMi if you have uncontrolled high blood pressure, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, a recent stroke or heart attack. Who should not take BESREMi? Do not take BESREMi if you have or had severe mental health problems, especially depression, suicidal thoughts, or attempted suicide, have or had a serious or untreated autoimmune disease, are allergic to interferon or any ingredient in BESREMi. Symptoms may include itching, swelling, trouble breathing, dizziness, or chest pain, have certain types of liver disease, have had a transplant, and take immune-suppressing medication. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you have any of the following: a mental illness, type 1 diabetes, heart or bleeding problems, problems with your immune system, hepatitis B or HIV infection, kidney or liver problems, are pregnant or planning to become pregnant. BESREMi may harm your unborn baby. Use effective birth control during treatment and for at least 8 weeks after your last dose. BESREMi may affect your menstrual cycle and could stop your periods. Do not breastfeed while taking BESREMi. What are the possible side effects of BESREMi? Serious side effects include low blood cell counts. Taking BESREMi can lead to infections, anemia, or bleeding problems. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, swelling in your ankles, blood in your urine, or loss of appetite. Tooth and gum problems. BESREMi can cause tooth loss and/or dry mouth. It is important for you to brush your teeth well, 2 times each day, and have regular dental examinations during treatment with BESREMi. Skin reactions. BESREMi may cause reactions such as rash, itching, and hair loss. Increased triglycerides. You may require blood tests to monitor levels. The most common side effects of BESREMi include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. These are not all of the possible side effects of BESREMi. Call your doctor for medical advice about side effects. You may report side effects to Pharma Essentia at 1-800-999-2449 or FDA at 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, at BESREMi.com.